Hello, my name is Dr. Padraig O'Sullivan. I'm a neurologist at the O'Donnell Brain Institute at UT Southwestern. In this video, I'd like to tell you what you can expect at your initial in-person visit to our interdisciplinary NPH clinic. First, a run through the NPH care path. Patients are referred to UT Southwestern for suspected NPH, usually by a neurologist or neurosurgeon. Our intake staff review the records to see if we have enough description from the referring doctor and if it sounds like it may be a case for the NPH care path. If we need more clinical notes or images, we will ask the referring doctor for these. Next step is a consult, usually with our nurse practitioner, which could be done by video. Links to educational videos about NPH are sent to help you prepare for your care here. Then you schedule an initial in-person visit for a detailed history and examination. Following the initial visit, many patients will undergo NPH testing to determine if surgery is your best option, in which case a shunt surgery can be planned. There's periodic follow-up in the months and years later. Now, please be aware that patients can move off the NPH care path to a different path at any stage. For example, if it becomes clear that the problem is not really NPH. We have a number of educational videos, including this one about the interdisciplinary clinic, an introductory one explaining NPH, one about our NPH registry, and one about the diagnostic prognostic testing that may be recommended to you at the end of your initial in-person visit. And also one about the surgical treatments that may be recommended. We hope that patients and their caregivers watch the educational videos, at least the first 3, in advance of making the initial in-person clinic appointment. With this knowledge, you can get the most out of the visit. There will be opportunity to ask questions specific to your situation at the appointment, but we hope that many of your questions about NPH testing and treatment can be answered in advance of the appointment if you are familiar with these educational videos. Also, the series of videos helps people decide if they really want to start down this care path. We will not be certain about your diagnosis after we examine you in clinic. Instead, what we aim to accomplish at the end of your appointment is a decision whether or not to proceed to the next step, which is testing for NPH. Or, said another way, by the end of the visit, we aim to reach consensus decision whether you are sufficiently likely to have NPH and are sufficiently likely to be better off if you get the shunt. If the answers to both questions is yes, we will recommend NPH testing, which includes admission to the hospital for lumbar drain and associated testing. Explanation of the testing process is found in another video of this series. For your initial visit, you can expect to spend roughly 3 hours with us, with some breaks. The activities are in 2 buildings, the Sprague and the Aston building, which are a short walk, less than a city block apart. Or you can pull up to park in both locations. Most visits start with a physical therapist assessment in the gym in the Sprague building. The longer part of the visit is in Aston Clinic 8th floor. You'll be checked in by the medical assistant, have your blood pressure taken and medication list verified, and your pharmacy and outside doctor verified. There may be some forms to complete, and you'll be invited to sign up for the NPH registry, explained in a companion video presentation. And then you will be seen by neurology, neuropsychology, and neurosurgery. I can tell you a little about what each of the specialists will be doing. Physical therapy will interview you about your walking and fall history and fall risk. And then they will have you do some walking tasks and balance tasks, while they time how long it takes, count how many steps you take, and score elements of your gait and balance. A neurology colleague or I will review your description of what problems you have relative to brain function, and particularly NPH type symptoms, and the timeline of your symptoms. We will likely ask you what tests and treatments you have already tried. We'll explore how various body functions are affected, for example, bladder and bowel, and sleep and mood and pain, and so on. We may ask you about your past history, family history, alcohol use, medications used in the past. And then we will examine your strength and sensation and muscle tone and walking and head and neck exam. The neuropsychologist will ask you questions about your cognitive abilities in the past and how they may have changed more recently. They will then assess various cognitive abilities such as memory, executive processing, speed of thinking, language skills, visuospatial abilities. Some will be written, some verbal, and some will involve physical tasks or problem solving. The psychologist may adjust the difficulty level depending on how well you are doing. Don't be too disheartened if there are parts of it you cannot do. Just give it your best effort that's available at the time of testing. Certainly, we understand that people don't perform at their best when they're tired or unwell, or taking medication, or anxious about the future. This is all taken into consideration in our assessment of the cognitive state and possible NPH effects on the cognition. The neurosurgeon will review your general wellness, your head and spine condition, including indicators of heightened risks for you with testing and treatment, for example, lumbar drain or ventricular shunt surgery. If you are taking blood thinner, or if you bleed or clot too easily, or may have heightened risk of infection, that may be factored into decision-making. The neurosurgeon will also look at the brain images available. Each member of the team looks at your case from a different perspective. By the time we have all seen you, we will each have weighed in with an opinion on whether or not you are best served by going on to the next step of care, which is the testing. If you and your caregiver accept the recommendation for this step, and you know your availability for a 3-day inpatient stay in the coming weeks, we can try to go ahead there and then and schedule the admission. Or you can get back to us subsequently to schedule the admission. Or we can set up a follow-up video visit if you have additional questions before scheduling admission. We recommend completing the testing within 3 or 4 weeks of your initial in-person clinic visit, because cognition and balance tests done here act as important baseline. If you don't expect to be available for a 3-day inpatient admission within the following month, then it is best to not make your visit to the NPH clinic yet, because we would need to repeat some of the baseline testing again. Sometimes the conclusion is that a person has NPH, but that surgical treatment is more likely to make things worse rather than better. That can be the case, for example, in people at high risk of surgical complications, or in people for whom the NPH is too far advanced. In these cases, further testing is not indicated, and we initiate non-surgical care of NPH. Finally, for those patients who on closer evaluation are more likely to not have NPH, we will not necessarily make a definitive diagnosis what you do have, but we may point you in what we think is the best direction. We look forward to being involved in your care, and we hope we can help you as well as possible. The mission of the NPH program at the O'Donnell Brain Institute is to provide the highest quality care to people referred for NPH, and to advance medical management of NPH through the scientific process.